Health, and I welcome you all for listening to this presentation. And in this presentation, really the concept is that almost anything new acts as an allostatic load because our body has not yet, through natural selection, optimized how to survive with these new materials. And for here, we can think of many different things that potentially would be a load and would probably be harmful. That can include acts like not walking and moving enough. We now sit so much, and the data is quite good that those people who sit 9 hours, 6 or more hours a day have an increased risk of heart disease and dying by up to 40% increased risk. That is remarkable if you think about it. Then we have other items which are totally new, which are like the trans fats. And all of you know that trans fats are no longer being used because they found to be harmful. Although they were initially introduced because the concept was you can eat now, have a fat taste, which does not absorb by the body. But there's no such thing as a free lunch in humans. Then we can think of electromagnetic fields. We are now bathed in these electromagnetic fields around us, from our cell phones to any electrical devices that may reach harm. Then we think of the exposure to plastics, which none of us have ever had. Then we think of having light at night. Again, there are many others. And then we think that we are smarter than nature, than our evolutionary history, by quickly doing cesarean births instead of waiting and being carefully monitoring the body and only do it when it's highly necessary. Or we suppress fever when in fact fever helps the body boost its immune system. Or again, going to childbirth and babies, we think that formula is better than natural breast milk. There are many examples. So in this presentation, I'll focus on a few of them. It's more the model to think about this. And so when new things occur, or you can ask, was this ever part of our evolutionary background? And if the answer is no, it's more likely that it could be harmful. Think of it even being part of nature. You know, for our whole evolution, we were walking, just like my background here, in nature. We were part of us. We would be, and in nature, we look at the far distance, then nearby. And the presentation of Mayor Schneider pointed this out last week, that when you only look nearby, you're bringing harm to the system, because now we're doing a behavior which is no longer normal. And it's a paradox, because the data is quite good that going into nature, walking along the beach, going into the woods, all these appear to have beneficial effects for health. It seems to reduce attention deficit and hyperactivity disorders. In hospitals, which are put in nature, where there's a lot of fresh air coming by, the cross-infection rates drop by more than 90%. And so it's sort of sad to me that in the era of COVID, that for a while we closed natural parks, and I understand you don't want to get close to people. But in fact, you're reducing the immune system's competence. By going to nature, you are enhancing healing. There's lots of evidence for this. And a very old classic study done in 1972 to 1981 was observing patients in a hospital. And here it was just the sense of being in nature. Those patients who had a view of a room of nature, i.e. a tree, a group of trees, versus those who looked in, who had a similar identical room, they saw randomly assigned by accident and saw only a wall. Those who overlooked a grove of trees left the hospital almost a full day earlier than those who looked at a brick wall. They also needed significantly lower doses of moderate and strong medications. This was published in 1984. You know, this is only the sense of looking at nature. But I think that's our evolutionary background reacting. When we view nature, we get it quick. You know, we do better. Prisoners have 24% fewer sickness when those cells face nature versus the prison yard. There are fewer illnesses and headaches. And people who are in nature have less negative impact on their job stress, or even tend to quit. And it seems that people recover quicker from disease. And in fact, there's even a term called nature deficit disorder for children. And then, that may be a risk factor for their attention deficit, for their maybe Asperger's symptoms, etc. That if they are playing in nature and are exposed, they seem to feel better afterwards. And especially for kids who are hyperactive. It may be better than Ritalin. And then if we take another one, we think of sleep. Again, this was alluded to last week by Mayer. Our eyes need absolute darkness. But we forget that now we don't have that anymore. We have always electrical lights going. Or if you live in a building, a car passes by with bright lights, or the street lights, or our warning lights of our electrical devices which tell them they're charging. All these are lights which hit our brain. And we know that light, when entered at night, suppresses melatonin, which is one of the hormones that's needed, that encourages more sleep production. And so by having a lot of light just before going to sleep, or light in the middle of the night, that's an older person going to the bathroom and now getting exposed to light, all of a sudden they wake up more and their sleep is disturbed. What's interesting is that if you do look at light for mice, then what you can do is you can put human breast cancer cells into the mice by a xenograft, and then you can ask to what extent will they grow. And what you see is that if the room is at night for the mice is totally dark, the growth rate is the lowest. If they have light at night, the growth rate is the highest. And possibly because the light at night somehow suppresses the immune system slightly. And we definitely know that people who have shift work have much poorer health status, live shorter. And so it's a significant risk factor. And then we are all part of a natural experiment. I don't feel it, I don't even know it. But I'm enmeshed by electromagnetic fields, EMFs. These are invisible energies, often referred to as radiation, non-ionizing radiation, that is associated with the use of electrical power and various forms of natural man-made light. So as I'm standing here, all these electromagnetic fields are just permeating through me. And even when I use my cell phone, it continually talks to the tower and it uses the electromagnetic field at the tower to communicate. And if the energy is similar to that of your microwave. So when I put the cell phone next to me, I'm continually being microwaved at a very low level. Now you can say, so what? But from a kind of conceptual perspective, you could say, we have not ever been exposed to that. Electromagnetic fields do affect the electrical potentials of cells. It has an effect. And it looks like in large studies that there are some negative, although low-level, negative side effects. There are reported data of rare breast cancers occurring in young women, especially in those who store their cell phone in their bra when they go out. Maybe that's due to the pressure on the breast, it's possible. Or maybe it's due to electromagnetic radiation. Or there's suggestive data that people have more brain tumors and salivary tumors on the side of the head if they've used a cell phone intensively for 10 years or more. And the same way for men, they appear to have more testicular cancer on the same side where they have their cell phone in a holster or in their pocket. I know the incidence is very low and maybe questionable. However, I do think of that in terms of the precautionary principle, meaning that if there's any doubt at all, assume that it could be harmful and act on it. So in public health, in a way, the precautionary principle states the following. The precautionary principle states, if an action or policy has a suspected risk of causing harm to the public or to the environment, in the absence of scientific consensus that the action or policy is harmful, the burden of proof that is not harmful falls on those taking an act. It really captures a number of aphorisms. It says, an ounce of prevention is worth a pound of cure. It's better to be safe than sorry. Look before you leap. It's really, you could interpret the precautionary principle as the evolution of a very ancient medical principle. First, do no harm. But let me take a few other examples where the data is much better, but I think in the same theme. So, and all the time as I give these examples, it's really just examples for a larger principle. We need to live in harmony with our evolutionary past. Now, let me ask you a question. How many of you drink from plastic bottles? I have a plastic water bottle. Most of us. How many store stuff in the fridge using some form of plastic wrap to store it? How many cook in microwaves with plastic containers? What we forget is that almost all these plastics, especially if they're in contact with fatty foods, that when they're heated, so the plastic molecules migrate from the plastic into the food and we ingest them. And in fact, even if you don't do it that way, you just drink plastic, you drink from a nice, healthy, quote, good water, right, from a bottled water. In fact, in the research studies of individual bottles of 27 different lots among 11 different brands in different countries, 93% of the bottled water showed some signs of plastic contamination. There were approximately 10 microplastic particles per liter in the bottle. Now that means when you're drinking it, you don't notice you're drinking. They're so small. You're ingesting them. However, they may act inside of you. And in fact, they tend to act as estrogens. And we know this from different data that almost all plastic contain biphenyl A, known as BPA, which is a component of the polycarbonate plastic used in most bottles and epoxies to line food and infant formula cans. It makes the plastic a little more pliable, and it's also used to coat the containers of metal cans. We use 2 billion pounds of BPA each year in the US. Remember, BPA was developed in the 1930s by pharmaceutical companies as a synthetic estrogen. But later, another synthetic estrogen, diacetylstilbestrol, DES, was used instead. But keep in mind, DES is neutral. BPA is not neutral. It is a synthetic estrogen. And 2 to 5 parts per billion is enough to prompt an estrogenic response in cells in the lab. Now, I know we're not in the lab, we are a whole system, but it's really shocking that it can do that. Okay, we do know that it's a lipophilic, fat-seeking. That means it's easily absorbed by the fat, and especially when it's heated, and it moves into the food, and then the food we eat, the plastics move into our bodies. We know that in animal studies, prenatal and early life exposure to very, very low levels of BPA alter the development of mammary glands in such a way to increase the sensitivity to estrogen at puberty and predispose the animal to cancer. It's implicated as in early puberty in girls, in which is a risk factor for breast cancer. Now, how many of you are going to continue drinking from plastic bottles? You see, we have a choice. The better way to think about it, BPA isn't known as an endocrine hormone disruptor or dysregulator. It imitates the body's natural hormones and thereby interfere with their functions. It mimics the structure and functions of the hormone estrogen. It binds to the hormone receptors and influences the body's normal body processes of growth, cell repair, fetal development, and reproduction. And we know that mothers who are exposed to BPA, their babies weigh a ½ pound less on the average than infants born to unexposed mothers. And has been shown to cause impaired brain development. It seems to be linked to increase to ADHD and anxiety and early childhood weight gain and obesity. You know, it has been, I can keep going on this. But why make it even strong? I'll make it even stronger in a different way. Remember what I said is BPA is an estrogen substance. It acts as an estrogen in the body. But we know that that may also have long-term effects by an accidental medical issue that occurred. And that is the use of diethylstilbestrol, known as DES. In the 1940s, DES, again, a synthetic estrogen, was used clinically to prevent certain complications of pregnancies, ideally to prevent miscarriages, etc. Then, by the 1950s, it was shown that it had no clinical effect. It had no benefit at all. It's like it was, However, in the duration in the 1940s to almost 60 to the 1950s, more than 5 to 10 million pregnant women and their babies have been exposed to this drug. So what? Nobody saw anything. And then accidentally in Massachusetts in the late 1960s, a mother was sitting in the waiting room with her daughter who had a rare vaginal cancer called adenocarcinoma, very rare for a very young woman. She was in the waiting room with her daughter, and then there happened to be another mother in the same waiting room who also had a daughter who had the same problem. The two mothers started to talk. And then one said, I always wondered if the drug I took, DES, is maybe somehow affected my child's development. I don't know. And the other mother said, I took it too. That led them to talk to the doctor. The thereafter led to the exploration and the recognition that by the late 1960s, that the exposure to DES in the womb to the infant led to a delayed illness in those daughters. Let me show you some of the illnesses that are linked to this. Notice the important part, keep in mind, here you have early exposure while being in the womb, and then the effects affect the baby, whether it's due to epigenetic factors in development, whether it's due to the hormonal disruption that occurred that changed it. It made the baby, as it grew up, more at risk. And now look at this. The clear cell adenocarcinoma, 40 times higher risk. For the same mothers, they had neonatal deaths when they gave birth. There was higher, 8 times higher. Preterm delivery, higher. Loss of second trimester, higher. Ectopic pregnancies, higher. Stillbirths, higher. Infertility, higher. Significantly higher. Increase even in breast cancer. Enough of this. But what does this say? This says that somehow, when we gave this drug in utero, it had an effect upon the baby eventually, on the fetus. And as that fetus grew up as an adult, it had long-term delays. I'm worried in that sense that our exposure to whether it's EMF, whether it's to the excessive plastics, all contribute. But you can't see it because we're all part of the same experiment, to the significant increased rise in immune incompetence, immune illnesses or dysfunctioning, possibly even the rise of depression, anxieties. We don't know what it is. But you can't even do a controlled study because there's no one in this world anymore who is not exposed. And if they are not exposed, they're so different because they're eating such different diets and other factors, you can't figure it out. But let me go shifting to another one where we essentially think we're smarter than nature at times. And the piece I want to think about for a moment, I would ask all of you, is about fever. How many of you, as little babies, when you had some form of fever, your parents automatically gave you Tylenol to suppress the fever? Or if you get high fever now, or if you have a fever now, you quickly take some form of antipyretic to reduce your fever. You know, it makes sense because you feel miserable, and therefore if the fever, you're sweating, you know, you want to suppress it. But remember, fever is not harmful unless it goes to 104. Fever is the body's natural response to boost its immune system to fight the infections. When we suppress the fever, it may suppress our immune competence over time and increase possibly other difficulties. There's some evidence for this. For example, if Tylenol exposure occurs during intrauterine development and in the first year of infancy, namely when the mother felt morning sickness or didn't feel well, she took Tylenol, or when the baby, you know, felt sick, had an earache or whatever, was given Tylenol, there's a significant increased risk of asthma and rhinoconjunctivitis and eczema by the age of 6. Wait a minute. So by suppressing the fever in early childhood, somehow we're getting a kind of immune incompetence problem by the age of 6. And how many of us now have had lots of medication to suppress fever? We may have conditioned our bodies not to raise a fever, because every time I raise a fever, I take the medication. Now I become classically conditioned that the moment the fever goes up, I drop it again. I may not be able to raise the fever. And there's some suggestion that people who have cancer have a lower core temperature and are not able to raise a fever easily. And if you can raise a fever, that's usually a good sign when you have an infection and you really raise it high, then often you're very successful overcoming the infection or the problems you have. And so I'm concerned about that we so quickly have thought we are so much smarter than nature. Fever, I'm uncomfortable. Let me suppress it. But what is the long-term harm? We don't quite often know. They're just suggestions. I am not saying if your fever is 104, don't suppress it. Please be careful, do watchful waiting. But there's some interesting other data on that. Let me put that in there in a different way. We know that children who never developed a high fever in childhood, which often occurs when we now do vaccinations or we quickly give the children Tylenols. So about 30% of those develop allergies, hay fever, and contact dermatitis, while children who have developed 3 or 4 bouts of high childhood fevers, only 5% develop these allergies. Is it that all of us now, so many of us who have food allergies or whatever allergies we have, is it that we got these kind of medications to suppress our fever, which inhibit it or sort of suppress our own immune competence? Interesting questions to me. We also know that with elderly patients who are hospitalized, usually are elderly patients with pneumonia, they come to the emergency room, so now you select all those patients who have high fever, some don't have high fever, and then you do a controlled study that half the patients get the traditional fever reduction in the ICU and half get watchful waiting. And when they looked at this on 82 patients, and they were randomized, that they found, and the groups were about equal, that those who get the aggressive fever reduction treatment, 7 died, while those who got the watchful waiting, only 1 died in the permissive group. As they're older people, you would expect them to die, but it's so interesting. So maybe having fever is not harmful. And we now know this may even be applicable to COVID-19 because it seems fever appears to be helpful in improving our immune defense and repair ability. It reduces the co-infections and the lung surface that are hospitable to viral docking. So getting a high fever may in fact may help you. And that is maybe why so many elderly, it's a hypothesis, are more at risk, because elderly as a group have a much more difficult time raising a fever. The best guidance right now, generally, for most Americans, is to avoid non-steroidal anti-inflammatory drugs, NSAIDs, particularly ibuprofen and others, which 30 American millions take a year. Okay. And finally, I want to shift to the area which you've all been reading about by the book by Blazer about the human biome. And remember that only 50% of your cells, or somewhat like that, are human. The rest are bacterial cells, about the size of your brain. They have more cells than our body because they're all generally much smaller. You know, and we forget that our gut and our brain are connected. Let me show you this interesting slide, which I happen to like. And you can see that if you look at not just the bacteria in your gut, but however the neural connections. We used to think, our brain affects our gut. But it works out when people did the neuroanatomy, 90% of the fibers go upward to our brain from our GI tract, and only 10% go down. Now that means that autonomic signals, what is happening into our bodies, our hormones, our nutrients, all go up to our brain and affect our moods. They induce our fear. They do many other things. And vice versa, when we perceive stress, it will reduce the blood flow to our GI tract. It's a circular system, but we have underestimated the power of our GI tract. And here is where the human biome may be important, because it affects our GI tract to a large extent. And when we have a healthy human biome with many, many different bacteria, and we haven't even looked at all the billions of viruses that are there also. Some I'm sure are very healthy, some are harmful. But there are many factors that affect our gut bacteria, which you have read about now. One, the birthing process. When during birth, we are coated by the fecal and vaginal bacteria from our mothers. These are the healthy bacteria, assuming that your mother did not have tons of antibiotics before. She may already have been compromised because of her diet, her medicational load before. But in theory, at least you would get more of the healthy bacteria. And also when we are breastfed, we are again getting exposed to more of the bacteria in our milk. And notice both of these processes have been disturbed by our assumption of wisdom, that we know better. We can quickly do when there's any risk at all, we'll do a cesarean. We now do more than 32% cesareans. 32% of women get a cesarean, although the World Health Organization would say only 5 to 10% needed. But we do it because of medical malpractice worries. We do it because we want to have the birth this Saturday or this Friday, not on Sunday, and many others. However, nature probably does know best. I would trust nature and only do the cesarean when it's true crises. And when you do very careful monitoring and allow the mother to feel totally safe, the cesarean rate significantly drops. And we know this because mothers who have doulas, who are present with the doula, and the doula is probably present there all the time, have a significantly shorter labor delivery and a much lower rate of neonatal complications for the baby, for the same equivalence. Okay, and then we later on get exposed to dirt. You know, we as little babies, we love to eat stuff, and there's nothing wrong by going out in the yard and eating stuff, ground, because there are all kinds of bacteria there. It's the healthy green dirt. I'm not recommending any of the city dirt, which is totally coated by the many pollutants of exhaust cars, or from in non-organic farms where the dirt is all sprayed with pesticides and herbicides, etc. And then it's our diet. Our diet has totally changed. We eat much less roughage. We tend to eat mainly high processed foods, which again shifts the bacterial in our system. And then it's our massive exposure in this world to antibiotics. And antibiotics kill classes of bacteria in our GI tract. And nature abhors a vacuum. And then other, less helpful, more harmful bacteria can take its place. And we really underestimated how harmful antibiotic exposure is. It's great if you have bacterial pneumonia, please use an antibiotic. However, in many cases, like whether it's from earaches to others, we overuse it massively. Okay. And there's some very good data that you can solve some of the problem. There is data, in fact, that when babies given cesarean births, if you now feed some of the poop, the mother's fecal mass, tiny bit, put it into the milk and feed it to the baby right away at birth, I know, oh my God. In fact, then the biome of the baby that's very similar to that of a cesarean birth. So what happens is that if you get a cesarean birth, you see many more harmful microbes in the human biome of the baby. And so you're trying to avoid that. And finally, when we think of the human biome, I just want to remind myself, as you're reading the book by Blazer, that it's a burgeoning field where we should think about. But really, we need to think, how far have we removed ourselves from our evolutionary past, that we have really reduced this kind of balance of all these different bacteria. We don't even give them a chance to either grow, or we have eliminated them. And we know when they are eliminated, often with antibiotics or other reasons, then we are more at risk for illness. And let me give a classical example of this, which you read about, and that's the treatment of C. difficile, Clostridium difficile. That's a very severe, dangerous infection of the gut, which causes diarrhea, fever, and can be fatal. It usually occurs in hospitals after antibiotic treatments. It's very difficult to treat. However, if you treat the people with a fecal transplant, you see a cure in 90% of the cases. It's mind-boggling. It's remarkable. It says, we're finally reintroducing what was there, what should have been there in the first place. Okay. But it's been interesting when people have followed these patients who have gotten these transplants by doing a registry. All of a sudden, you realize that the human biome, or these bacteria, are not just neutral. They have physical and emotional and effects. So let me give a few examples. And this is a very new area, but I would think it seems worthwhile to explore more. For example, when giving fecal transplants from lean donors to obese people with metabolic syndrome, that's almost like pre-diabetic, whose insulin levels are less able to lower their blood sugar levels, their insulin response returned to normal after their fecal transplant. Wait a minute, they got rid of their metabolic syndrome. Similar clinical observations have been seen in some selected patients with ulcerative colitis, depression, and even a patient with alopecia who had no hair growth at all and needed to start shaving afterwards. I would never have thought that one. The GI one and depression makes sense to me because many mental, emotional issues are associated with a kind of stomach ache, stomach discomfort, which you could say is highly linked to the human biome. When we change the biome, we may change our mood and other illnesses. There's even some suggestions. Well, let me first go to obesity, which is clear. When you take mice who receive lean mice who receive a fecal transplant from fat mice, their weight increases. Similarly, this is also by case reports. These are all case reports, no controlled studies. But it's a case about a patient who had a fecal transplant from her obese daughter. A year later, all of a sudden, she experienced massive weight gain despite diet and exercise and medically supervised protein diet. You know, maybe when we think of us, that there are so many of us are now more heavy or obese, we can blame both the diet, yes, and you heard me say this a number of times, we're eating much too much processed foods. But maybe we may need to blame or find another cause, and that is the exposure to early exposure to antibiotics. Because what do antibiotics do? They cause animals to gain weight. That's why they have been used for the last 30 years by farmers to treat their cows or animals, because when you give a very low dosage of antibiotics in their food, these animals gain weight. And so maybe some of you, that is the result. Or it is that your moms, notice the moms are being blamed, that your moms already got the antibiotics, their bacteria was already shifted. So when you were born, you did not get the right bacteria, which then put you at risk for increasing weight. It's very interesting to think about this. And then just think even about other difficult illnesses such as autism. It looks like that children or humans who have autism have a different gut population of bacteria than those who don't have autism, at least in children. And I now wonder, if you do a fecal transplant from healthy, dynamic children to an autistic child, would the behavior change? That would be an interesting perspective. I could think of that as a possibility. And in animal studies, it looks that may be possible. So I'll end on this with an animal study. This is on autism and the microbiota. Okay, here you take pregnant mice, you infect them with the flu virus, which causes autistic-like symptoms in their offsprings, in the baby mice. What that means is these baby mice are less social, squeak less, display repetitive behaviors. And biologically, they have a leaky gut syndrome, gastrointestinal tract, that allows bacteria to move in and out of the lining. And the bacteria in their gut are significantly different from the mice without autistic-like behavior. Now what you do is you treat the autistic mice with these missing bacteroids. So you give them these different bacteroids, and what do they then see? The gut became less leaky, and the autistic symptoms decreased. They stopped repetitive movements, squeak more with their opposite sex mouses. It's an interesting question about this. And I would now recommend that we really start thinking about this concept of that we are part of an evolutionary past. When we step away from that, or we think we're smarter than that, it may not be the case. And the final piece is you want to think not of the effect only today, but the long-term possible effects. So on that note, enjoy and stay healthy.